Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, we're going to get a little update from the state system of higher education. The Chancellor of the state system is in the House, and then Dr. Stuart Shapiro, he's the president of the Healthcare Association. What would we talk about? Healthcare? With the big bills pending in Congress, all of that and more following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi again, welcome back to the program. Sitting across from me is Dr. John Cavanaugh. He's the Chancellor of the State System of Higher Education. Chancellor, welcome again.
It's glad to be back.
All right, look, I want to get right to it. You're not hostage. We want to get this straight. You know, the state-related. Can you get into this? I know this is complicated. It really is, because Penn State and state system. Go ahead, talk about that.
Sure. Thanks, Terry. Yeah, a lot of people still have us confused with Penn State. Penn State's a wonderful institution and all, and you're right. Unfortunately, theirs, along with the other state-related budgets, are being held up. But PASHE is the 14 state universities. I'm sure many people are familiar with Westchester University, Millersville, Shippensburg, Slippery Rock, Clarion, and so on. That's the PASHE system. One thing that we hope is that folks will start associating those universities with our system.
Right. Well, yeah, I understand. I mean, look, full disclosure here, I was a professor at the Millersville University for many years and chair of the government department. So, and I understand that. I mean, I'd get that people kind of confused. But you're not held hostage. You got your money now. You didn't get as much as you want, I'm sure, and you're going to be fighting hard to get your. How did you do in the appropriation? What are the challenges there that you have?
We did okay in the appropriations in the big picture.
Okay.
What the General Assembly and the governor did is to provide us some of that the federal stimulus dollars
money,
in lieu of state appropriations. So what we're hoping is by 2011-12 that the economy's turned around, the state revenues and resources are back, and we're back whole like we were last year.
Yeah, well, I mean, one of the things, we can argue about all sorts of expenditures out of state government. Now, I've always been sort of partial to two. One is we got to have roads, bridges. We got to have an economy. We got to move people and goods. And the other one is education, because we have this big brain drain, and we got to be real careful that we don't have an educated workforce. And there, the education system needs to be a significant priority. Maybe I'm wrong about that, but I don't think you would disagree with me on that one.
No, absolutely not. And the important part for PASHE, our system, is that not only do we do what most people would associate with us, bachelor's degrees and graduate degrees, but in large parts of the state, because there are no community colleges, we provide the lion's share of workforce education. And two-year degree programs that otherwise just simply wouldn't be available. So we really play an important part in the economy of the state.
Well, plus you take a lot of indigenous Pennsylvanians who then stay in the state. I mean, which is a huge problem, because we cannot have young people just going elsewhere, which is why we need jobs and education go hand in hand, unless I'm on Mars and lost that somewhere.
No, not at all.
In the course of my lifetime.
About 80% of our bachelor's degree graduates stay right here in Pennsylvania, and it goes back to the fact that PASHE is a great investment, and we are the future of the state economy.
All right, well, let's talk a little bit about some of the programmatic changes. I mean, look, everybody knows that colleges, 30 or 40 years ago, they were mostly academic and had few professional programs, and certainly didn't have a lot of programs that were designed specifically to meet niches within the economy. Now, we've got lots of big changes. We've got nursing schools. You have technical programs that provide a balance of academic and vocational education. In your system, there's been a pretty significant evolution in the last 30 or 40 years, and new outreach programs.
That's exactly right. One of the things that we're trying to do is to make sure that our academic programs are not only current in the sense of the content is current, but also provide opportunities for students to move into the emerging careers, whether it's nursing, like you pointed out, or whether it's environmental careers, whether it's in the energy industry, and a lot, Pennsylvania is a great place for that. Alternative sources of energy, the Marcellus Shale, wind and solar and so on. So one of the things that we are looking at is the mix of academic programs that we have. Does it meet the needs of the Commonwealth and the country? And how do we maintain our currency and our academic excellence to make sure that the students who go through those programs, whether it's core liberal arts or nursing or business or whatever,
so it's the
are graduating with the right set of skills?
So it's the diversity. I mean, the universities, the point is to offer a variety of programs that meet needs and not get sort of caught up in one little niche, so that feel that you're better off, and the residents of the state are better off by having a... Plus, you brought this other point up that we tend to forget about, and that is that many of the state system campuses are in areas of the state where there's not a lot of employment and a lot of jobs, and so you're a significant factor in the economic development of those regions, right?
That's exactly right.
Think of Mansfield and Lock Haven and California out in the Mon Valley.
Yeah, in many of our locations we are by far the dominant employer, and in many others certainly in the top 2 or 3.
All right, when talking with the Chancellor of the state system, we're going to take a little break. We're going to talk about, when we come back, this whole business of transfer credit. You have a kid in the community colleges, there are thousands of them. You want to go to a state system school, how easy or difficult is that? You stay with us, you'll find out.
This broadcast of Pennsylvania Newsmakers is sponsored by Citizens to Protect PA Jobs. When businesses add jobs, people prosper. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, we're talking with Chancellor John Cavanaugh of the State System of Higher Education. Chancellor, let's talk a little bit about, look, over the years, sometimes there have been complaints, and sometimes I thought the situation was worked out when you start to transfer courses from, let's say you're at a community college. We have thousands of people in community college, 14 or 15 now.
14 community colleges.
14 community colleges, and they want to come to many of them will go to a state system school following that. There were problems with degrees and courses. Where does all that stand? Tell the viewers out there.
Sure. In most of the states in the United States, it's a very easy process to transfer from community college to the state universities in that particular state. Pennsylvania was coming a little bit late to that in a couple of ways. One was just the ease with which the transfer can happen and the ability to take a whole associate's degree with you in that transfer process. Because the community colleges in Pennsylvania are independent, you have to work out individual articulation agreements with each community college. One of the things that the legislation that recently passed will do is to do away with the need for those individual, 14 times 14 type permutations. It gets a little weird,
and difficult to administer.
Right? And so now we'll have one process by which a student at a community college in Pennsylvania will be able, after they complete an associate's degree, to transfer to any PASHE university and have the credits that they earned in that associate's degree count without having all of the separate articulation agreements. That process is just getting off the ground. We're going to be having discipline-based, like social science, and so on, faculty groups from the community colleges and the PASHE system work out the details because it's vital that the faculty get involved in this. But by the end of that process, it'll be a seamless transfer for students, and I think that will give students a great opportunity to take advantage of the community college system as well as the state university system, particularly for those that, for many, many reasons, can't start out at a state university.
Yeah, I mean, that always seemed to me to make a lot of sense. And you get into this individual evaluation of transcripts and credits, and inherently there's nothing wrong with that because trying to preserve the academic integrity. But for all you folks out there of students in community colleges, and you're thinking of transfer, this is a pretty big deal. First of all, not only do you make sure that the academic situation is straightened out, but it saves money.
Right.
I mean, it saves money because no one wants to take any more extra courses than you need. You want to provide with the necessary education. All right, I want to go to another issue, and that is, give me an assessment of what you think is the health right now of the system. I mean, let's talk about the economics of it. Mm-hmm. The stimulus money goes away. How serious a potential problem is that for you?
Right now, in the fiscal year 2009-10 budget, we've got about $38 million in federal stimulus money that replaced state appropriations.
Okay.
So worst case scenario, if that money doesn't get replaced in terms of state dollars, we would lose $38 million essentially overnight in 2011.
Now let me jump in here. In spite of that possibility, you now have a record enrollment.
That's true.
So now let me figure this out. You have a record enrollment and less money. That doesn't seem to work.
Well, the record enrollment also brings in some tuition revenue.
Yeah, of course,
but you know, tuition doesn't cover the in-state tuition does not cover the full cost of education. So, yes, you know, the additional revenue is absolutely essential on tuition.
Right.
The bigger picture is that that it comes in at a particular discount rate because you don't get the whole amount of funding that you need to support.
For those of you who are out there thinking of applying to a state system school, tuition at the current level now is what? Tuition?
Tuition and fees all together is about $7,300.
Yeah. Now that seems like a lot of money, but when you think about it, for $20-some thousand, you get a 4-year. It's the price of a car. I never could understand that. I mean, I know it's a lot of money. We do have high tuitions. Public, and I'm sure as Chancellor you're going to make the argument, and I wouldn't expect you to do it.
And we need to, and I think that I want to thank the Board of Governors for their dedication in holding tuition down.
But overall, when you think of
it's a great buy.
It's
a great buy.
Yeah. Well, look, I want to thank you for coming in. As always, you're welcome here. This is a great update, and look into the state system. Am I allowed to say that? I guess I can do whatever I want. Been the host too long. All right, healthcare update. Dr. Shapiro is in here. We're going to get into this big national healthcare debate. He always has some wise words for us. We'll see you on the other side of a paid commercial.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. All right, Dr. Stuart Shapiro is here. We bring him in. He's the president and CEO of the Pennsylvania Healthcare Association, as I think all our regular viewers know. Boy, I'll tell you, what an appropriate time. We're in the midst of this huge debate on health care in the Senate. We had the big debate in the House. Dr. Shapiro, let's talk a little bit about give me the overall picture about this health care. We can get into the parts of it, all 2,000 pages of it in the Senate bill. Give us a breakdown of what you see sort of overall that folks should be aware of.
Well, we have a 2,000-page Senate bill and a 2,000-page House of Representatives bill. And virtually no one's have read these. And I was trained as a physician, and Hippocrates was somebody we learned about. That was 2,500 years ago, the 4th century B.C.
Wow.
And the Hippocratic Oath, which is what medicine is founded on, is first do no harm.
Do no harm, yeah.
And this bill, these bills, which neither has really moved totally forward, and they would have to be reconciled, really have the potential to do some harm. And while America is unfortunately, tragically, the only industrialized country in the world without some form of universal health care, What these particular bills can do, have the potential to do, is to harm our entire healthcare system that we have today.
Wow.
We need something,
right,
but we don't need these because there's virtually no reform in the healthcare reform.
Now, you bring up something interesting. In all the polls that I've seen and some that I've done, the voters are with you. They say we want universal coverage, but they're not happy with what they've heard about or learned about in the course of the last couple months about some aspects of these, the provisions in these bills.
Let me give you a couple of examples.
Please do.
The bill in both the Senate and the House contains $500 billion worth of budget cuts for Medicare.
Yeah.
The fact is that that will affect care for seniors. Mm-hmm. These bills will put a burden on state budgets that are already overburdened by expanding their Medicaid programs. These bills have virtually no, in each of their 2,000 pages, any tort reform. And you need tort reform in order to reform the system. Neither of them really supports expanding the core services for the very poor without an extra tax on those who already have insurance. Mm-hmm. No one's looking at the macro as they look to do what is morally right,
so in
which
other
is
words,
pass health care reform.
So your point would be that it has all these parts to it. And looking at one of the parts, it might say, okay, this part's okay, but when you get looking at the total picture, it doesn't pass anybody's kind of reasonable estimate. Here's the point that I want to make. We're going to pay for this 10-year plan over 5 years. We're going to pay for it over 10 years. We're only going to get 5 years of benefits from it. In other words, it's not scheduled to kick in. Now, how is that going to work? I mean, so what they're saying now may be $1 trillion or close to $1 trillion, actually $850 billion, but in the end could end up costing $2 trillion when you go into the next decade because of this problem. Am I right or wrong about that?
You are 100% right. The Congressional Budget Office is doing what they're told to do. Score this over 10 years.
Yeah.
They count revenues for 10 years. They count expenditures for 6 or 7 years.
Right.
And if I ran my business that way or my pocketbook, it wouldn't balance.
Yeah.
That's not to say we don't need some immediate reform.
Sure. I'm going to ask you about those. We're going to go to break. I want to talk about 3 or 4 of the things that you think that we ought to do following these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by Penn Future, where we believe that every environmental victory grows the economy. And by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back with one of the experts we call in from time to time, Dr. Stuart Shapiro. We're talking about the health care bill currently being, health bills, I guess, that have to be reconciled, being debated in Washington. All right, if you were going to design this program, I mean, what are the key elements that you think need to be in it?
Oh, first of all, I would take the good of these bills.
Okay.
I'd have community rating.
All right.
I'd make sure that no one was ever turned down for health insurance. I would have it portable between employers. I'd begin to expand coverage. I would phase it in over time. I'd put in cost controls. Mm-hmm. I'd mandate that only procedures that have been shown to work are paid for, so it's quality-driven and not just quantity-driven. I'd make sure that long-term care was included in the appropriate way. I'd make sure there were no burdens on the state. This is all common sense reform. And then you add to all of that tort reform. And as you look at all of those 4,000 pages, there is really no ability to control or change that cost curve.
Right.
So what we're doing is we're just going to keep spending, and we're not going to improve the quality.
Look,
we will improve the access, but it just doesn't get at it.
I don't think I could have anybody in here better to ask this next question to. One of the things that I thought about, little old humble guest here, or host here, we got all this waste, fraud, and inefficiency that everybody knows. Every report. Shouldn't we have done something earlier about getting rid of that so that the right amount of money gets to the right people?
Well, I think that...
Or is that overblown?
I think that is way overblown.
Okay.
Is there some fraud? Sure. And it needs to be eliminated. And every year the government gets better and better.
Okay.
And they need to get much better.
Okay.
But to say that that's going to save us...
It can't fund the system.
It can't fund the system. And it's hypocrisy to keep holding those words, fraud and abuse, up there and saying that's going to allow us to expand coverage.
Yeah, I think politically it would be important and valuable to get people to buy into it if they thought, for whatever value that has, right?
But economically it's not going to...
Yeah, because it's not the literally hundreds of billions that we're going to need, hundreds of billions that we're going to need to fund health.
People use it to divert attention.
Yeah.
For example, the trial lawyers have made sure that in this 4,000 pages, there's no tort reform. It's not mentioned.
Yeah.
It's not on the table because people talk about fraud and abuse. Let's get down to the real business of providing Americans with access to health care in a common sense way and in a way we can afford it going forward.
Yeah. Okay, before I let you go, prognosis here, I think the Democrats personally have to get something done politically. Whatever they have to do, it's now gotten to that point. Am I right or am I wrong?
They'll get something, but I don't think they're going to get the full enchilada.
Yeah.
And I think that'll be in the right direction. Mm-hmm. But I don't think that we're going to see a universal expansion past this year.
Well, a lot of the bills still leave millions of folks uncovered, as I understand it. And that is not likely to...
Expensively uncovered.
Yeah, expensively uncovered. All right, well, as always, thanks for coming in. You provide a lot of valuable wisdom as we try to understand what I think is not arguably one of the more complicated policy subjects that Congress has taken up in decades. All right, we'll see you next week for another edition of the program. And as always, you like this, stay well.